And another health concern right now, West Nile virus, after mosquitoes in both Dallas and Tarrant County have already tested positive. That's just one disease that mosquitoes can carry. As we welcome in our medical expert, Dr. David Winter from Baylor Scott & White Health. Dr. Winter, I don't think I have to tell people just how much of a nuisance that mosquitoes are. What do we need to be on the lookout for?
Well, there are lots of different mosquito-borne illnesses. You said West Nile virus. There's also St. Louis encephalitis, lacrosse encephalitis, Zika virus, dengue fever, chikungunya, and malaria. Malaria is the most common worldwide, more than 500 million new cases a year, 1 million deaths. Not much in America, thank goodness. The biggest one here, as you said, West Nile virus, most common blood mosquito-borne virus in this country.
And I'm guessing it gets its name from the West Nile somehow. It got here. What's the origin?
Yeah, it was first recognized in the African country of Uganda, then quickly recognized in other countries down there, all west of the Nile River. That's how it got the name. It's all over right now. Subtropical, tropical areas all over America, most common in the southern states, including Texas. We need to be worried about this here, Mark.
Well, let's talk about symptoms then. If we are going to be worried and let people know about it, what should they be on the lookout for if they think they've got a mosquito bite that might have gotten them sick?
Yeah, now to be fair, most West Nile virus bites don't cause severe illness, but a good friend of mine was in the ICU for 3 weeks last year, so I've seen this before. He had high fever, horrible headaches, got into a coma, had seizures, and finally recovered. We don't have good treatment for this. We had just to support his heart, support his lungs during that. So you don't want to get this. You want to try to avoid it whenever you can.
You know, it's funny, I read an article the other day about some gene therapy they thought they might be able to use to eventually eradicate mosquitoes in general, and the ethics of, you know, what do you do with this situation and how do you, is that the right thing to do, you know, ethically? But I think until we get rid of the mosquitoes, we got to stay away from them and try to stay healthy from things like these. So what do you recommend there when it comes to trying to avoid getting bitten so that you get sick?
Yeah, that's on the horizon, what you talked about, Mark. There's also a fungal disease that if it's spread among mosquitoes, they quit reproducing. That may be also treatment. None of those are available right now, so you want to be careful. Know that mosquitoes are most active early morning, late evening hours. Those times you may want to wear long sleeves, long pants. Use mosquito repellents. DEET, Promethium also works very, very well. And just be careful because mosquito bites can be nasty. We worry about those. Now, let me just reassure people, most mosquito bites are just pesky and they're a nuisance, but be careful. Stay away from them whenever you can.
Well, we know that we're coming into the summer season when people get out and about, when mosquitoes kind of get to be at their peak. Where are we now when it comes to mosquito season?
Yep, they've just started up right now. Another thing I would add, Mark, if there's standing water around your yard, get rid of that. They can multiply very, very quickly with that. That's how a lot of people get them around their yard when they're hanging out. So be careful. Mosquitoes are out there. They're starting to come. They're going to get worse as the summer goes on.
Well, Dr. David Winter from Baylor Scott & White, great information. I'm going to stay indoors in the AC and just keep the mosquitoes at bay, hopefully.
There you go.
All right, thanks.